And I'll say, oh, hi, Alice, how are you today? Can I take a peek at you? Look at your eyeballs. They look really good. Sclera are nice and white. No changes in her corneas, and there is no discharge. You pull down that lower lid, put a little bit of back pressure on that eye, and her third eyelid will come up, and you can assess her third eyelid. And I will check that on the other side as well. Nothing red, nothing abnormal, and they're symmetrical side to side. One is not more pink than the other. Good girl, you're doing a great job. She's a good girl, aren't you? All right, we're going to check your pupils. Hello, sweetheart. We're going to just check. And what should her pupils do when I shine a light on them?
Dilate. Or constrict.
Constrict.
That's on the video now. Great.
And they do constrict. That's great. And then you check both of them. So I have no concerns with her eyes right now. I'm going to look at her nose, and it is equal, symmetrical, side to side. There is no discharge, nothing red, nothing irritated, nothing scabbed. Then I'm going to take a peek in her mouth. And the first thing I do is check her bite. And she's got a great bite. Nothing is in the way. I come all the way back. When you guys check teeth, you come all the way back to those back molars. I want to see everything, both sides. Because her cheek teeth, these guys over here, are going to be the ones that are going to develop the most amount of tartar, most likely to have big nasty cracks in them, and the things that are most likely to be missed by an owner. They will definitely see if one of their big canines is broken off. It's often that they'll miss that these teeth are broken back here. And then you're a good girl, and your gums look healthy, and I don't see any lumps or bumps, just a little bit of mild tartar on those carnassial teeth. And then I'm going to take a peek on the inside. Nothing on the roof of your mouth. Your tongue looks good. Nothing that I see. Good job. You did a great job, Alice. That was really hard, wasn't it? And the whole time I'm scratching her, and she thinks I'm just loving on her, we're actually checking for lumps or bumps or any asymmetrical spots on her head. And nothing at all feels abnormal. Then I'm going to feel her lymph nodes. And we've got some mandibular lymph nodes here. And we're going to, hers are tough. They're not really great teaching lymph nodes because they're pretty little. She's got some great big salivary glands back here that we'll get used to feeling. Okay. And then the next thing I do is I roll down and I feel her prescapular lymph nodes. So those are going to be, Alice, you look up. There you go. Look right there. You want to keep her head just like that. Prescapular lymph nodes. She's in kind of a wonky position, but we'll show you those on some other patients. You get your thumbs into these jugular furrows here, kind of push back, and then I run my fingers up and down, looking to see if I can feel any lymph nodes. And lymph nodes are going to be a bump in the wrong place. Okay? So we will keep trying to find dogs that have good lymph nodes for you guys to feel. So I go from here, I slide down, and I make sure I catch these. All right? So good job, Alice. I then come back up to her ears. And we're going to go through this on the video about what a good tympanic membrane is going to look like. Hi, Alice. You know what? Because your mom says you get a little fussy pants, we're going to put your muzzle back on while I look in your ears. Just because mom says you get to be fussy pants. Good girl. Well, we don't need them. We need to lose an eyeball. Hard to do a job if she has no eyeballs. All right, turn your light on. Remember, her ear canal is going to go straight down and take a right turn and go into her head. So if all you're doing is this, I know you're not looking at her eardrum itself. So keep her head up just a little bit. We're going to go here, and I'm going to look down, and I'm going to look for anything that is red or swollen or discharge. And then I'm going to actually kind of have to get myself in there a little cattywampus. I know, sweetheart, that's a little bit tickly. And I come down and straighten out that ear canal, and I look for her tympanic membrane, and it is a shiny thing at the end of a long tunnel, like a piece of cellophane. But we'll talk about that when we show you your video next week. I come through on the other side. I look down. And I will tell the owner that nothing is red, nothing is swollen, there is no discharge. And I come all the way down, straighten out that ear canal, and there is her tympanic membrane. And this is not the brightest light, but it is intact. There are no holes. Good job. That was the worst thing that we're going to do to you today. Good girl. All right. She's being lovely. I just put the muzzle on just to do her ear canals, and that's it. All right, why don't we get her to stand up? Good girl, darling. Okay, so I've got her head done, and I've felt those prescapular lymph nodes. For me, then I come back, run my hands over her whole body, just checking for any lumps or bumps. And I'm going to come through this way, excuse me. Up and down, feeling wherever I can feel. I will check her popliteal lymph nodes while I'm back here. And those are going to be right behind her knee. And hers are pretty little, so not great teaching ones, but we'll keep trying to find some good ones for her. So I check those lymph nodes. I check for inguinal lymph nodes. You should not palpate these unless she is sick for some reason. And I will also feel up in her axillary region, checking for those lymph nodes as well. Those should not be palpable unless there's a problem. For me, then I check her tail, make sure there's nothing under there. Check her perineal region, nothing unusual there. For me, then I also then go check through and check a flea comb. She's got thick hair and does not really love that flea comb. It's thick. Good girl. Check it out. So then, because I can't just really easily go through her hair coat with a flea comb, I will do my best, but then come back and go backwards throughout her hair coat, making sure I don't find anything that is scabby or red or swollen. I'm going to come on this side. Don't forget she has two sides. She could have a raging hot spot on this side and nothing on the other side. Right, see nothing. She's girl, aren't you, Alice? So that's what I do.
Better for you guys than she is for me.
Of course she is. So I kind of do all that superficial stuff first. Then I come back and I will assess her heart and lungs. In general, listen to her lungs first. The heart is what you guys are used to listening to, but get out of that habit. Listen for her lung sounds first and ignore that heart altogether. Okay, because once you focus in on that heart, you're going to start tuning out those real subtle lung sounds. So listen to her lungs first. If you've not taken a TPR, you can do her respiratory rate at this point. You're doing a good job, Alice. Good girl. And you'll listen at all quadrants. Okay. Then take a listen to her heart. If you've not gotten a heart rate yet, this is a good time to do it. Both sides. Good girl. Good girl. I would expect that while you are taking a heart rate, you put your hand on her femoral artery, and you're also getting her pulse as well. Every beat should have a pulse. So you should be listening for her rate, you should be listening for her rhythm, you should be getting a good feel of what that sounds like as well. Making sure that you've got a nice strong lub dub, lub dub, lub dub. If you don't, if you've got a swish somewhere, sorry to be ignoring you. If you've got a swish or something that you feel doesn't sound normal, just ask somebody. Say, hey, could you just take a listen? This rate sounds funny, or she's got a funny rhythm. Just flag somebody, and I'm either going to say, hey, good catch, I agree, or no, that's pretty okay for this dog. Okay? So, Alice, you smell like pee. All right. Then I will come back and I'm going to palpate an abdomen. And I would recommend feeling bellies for you guys. You are not going to be great at palpating abdomens. It takes a long time to figure that out. And what feels normal and what does not feel normal. I would expect that a technician can palpate a bladder. She is as tense can be. Plus we also saw that she piddled all over the place. However, she still has a bladder. It's tough to feel, but it's there. So sometimes when they're real tense like that, I'll put one hand just steady on one side and I'll kind of do this on the other side. Well, I'm talking to them. Hey buddy, how are ya? And sometimes the tail goes and it tends to relax them a little bit. And then I can kind of push those organs against rather than doing this, because sometimes that goes, I don't want to. Okay, so something to try anyway. So definitely try for a bladder when I am asking you about your PE. One of the things I'm going to say is, hey, how big do you think your bladder is? And if you say this big and it's this big, then we're set. Okay? So just get used to that. Okay? So then I've taken care of respiratory system, her GI system. I sort of checked GI when I was checking her perineal area and her rectal area. And then the last thing that I want to do for me, because dogs generally don't love it as much, is checking out her kind of her orthopedic system. So as I was feeling her originally, I was feeling for skin lumps and bumps. So we were doing the kind of that cutaneous system. I'm also feeling for symmetry. You know, she doesn't have a big bulge over here of muscle and no muscle over here, kind of doing that all at once. And then I work my way all the way back, make sure that those little ham hocks are equal, side to side. If not, if you've got one that's real skinny, there might be a problem with that leg. She might not be using it as well. So I come all the way down, again, still feeling for any lumps or bumps or asymmetry. And then I will do a little bit of range of motion. Careful on this one because there is anal glands that are right there. And good girl. Yes, little stretch. Good girl, little stretch. I'm supporting her and I'm moving that stifle. And she's not fussing at all. No lumps or bumps or clicks or cracks. Checking that hock. Checking her toes. While she's up here, I'm checking her pads. I am checking and feeling between her pads, checking her toes, toenails, do a little, I don't know, even a little CP check. So we put her toes down. And we let her go and she flips it. There you go. There you go. And then I'll check her on the other side and I support her. And I do a little extension, make sure I don't hear any creaks or cracks. Oh, good extension, good girl. Checking that stifle, same thing. Checking her hock. Checking her toes. Checking those pads. Feeling between her pads. Checking her toenails. Make sure there's nothing scuffed or broken. I gotcha. Yeah, you got 4 legs. Don't use Emily. And you put that toe down on your butt. You put your toe down. And she flips it. Okay? Great. And then I'll move to front leg. I know. We're going to flex her shoulder joint. Extend her shoulder joint. Oh, you're tense. Flex and extend your elbow. Check your carpus. Check your toes. We've got good pads, nails, come up over the top, feel between toes, check the toenails, good job. I have to check the other side of the darling. Okay, so let's spin her around. Good spin, excellent. We're going to, I know you're tense, relaxing your shoulder joint. Extending your shoulder joint, checking your elbow, checking your carpus, checking your toes. Paw pads look good. Feel between toes. Check toenails. Okay? How's your CPs up here? You're leaning on Emily, so I suspect they're going to be bad. Okay, push her away from you. Perfect. She has to actually put weight, and she flips. Yeah. That looks slow, but she's putting all her weight on Emily. So, did I miss anything? You can tell me if I did.
Smells like she really threw her own bands.
No, that's just me, honestly. No.
Was that you?
No, not my anal glands. It's just my.
What the?
So, no. All right. That's a physical exam.
First time I smelled it.
Yes.
I
Shake your
smell
legs.
it.
Smelling south.